My dear friends, blood pressure. It sounds familiar, yet it's like an old friend we never truly understand. At this age, we may no longer chase the numbers on the scale, but we begin to live with the numbers on the blood pressure monitor. And there's one thing I've realized after decades of being a doctor in the United States, many people, even those who deeply care about their health, still unintentionally make mistakes with their blood pressure. I've met patients who measure their blood pressure every day, but do it in the wrong position so the numbers never truly reflect their real condition. Some think a little high is probably fine, but in reality, every number above the safe range means the heart has to work harder. Others stop taking their medication when they feel fine, not knowing that decision could lead to serious complications. Have you ever felt that way, that you're trying your best yet the results aren't what you hoped for? Today, I want to sit down with you and look directly at these common mistakes. Not to blame, but to understand and to avoid them. Because after 50, every health decision is either a step forward or a step backward for ourselves. You know, among all the mistakes I've seen in older patients, there's one that seems so simple, yet is incredibly common: measuring blood pressure the wrong way. I remember a gentleman named Robert, 68 years old, living in California. He was very diligent about checking his blood pressure every morning and evening. One time he brought me a notebook full of daily records. It looked truly impressive. But when I asked, "How do you measure it?" his answer made me immediately understand why his numbers went up and down so unpredictably. He said, "I measure while watching TV, sometimes after eating, or right after gardening." Sound familiar? I believe many of us have done the same. The problem is, blood pressure is not just some random number from your body. It changes with activity, emotions, and even your sitting position. If we measure it at the wrong time and in the wrong posture, the result can be much higher or lower than reality. And from those wrong numbers, we might make wrong decisions. Taking medicine when we don't need to, or feeling too relaxed when our blood pressure is actually high. I want you to imagine this. You're about to measure your blood pressure, but you've just walked up the stairs and your heart is still racing. The machine will show a high number. You panic. On the other hand, if you're lying down resting and then take a reading, the number may be lower than usual. So how should we measure it correctly? From my 20 plus years of experience, I usually guide my patients like this. Sit still with your back supported and both feet flat on the floor. Rest for at least 5 minutes before measuring. Keep your arm at heart level. Wrap the cuff in the correct position. Not too loose, not too tight. Measure at the same time each day, preferably in the morning before eating and before taking medication. But above all, don't rely on a single measurement. Take 2-3 readings 1 minute apart and average them. And when you write them down, note the circumstances. Were you resting? Had you just eaten or just exercised? This information will help your doctor see the full picture. Another patient of mine, Linda, was once diagnosed with high blood pressure just because her reading was high at the clinic. But after I taught her the correct way to measure at home, we discovered she only had white coat hypertension, meaning her blood pressure went up only when seeing a doctor due to anxiety. If we hadn't checked carefully, she might have been on medication for life unnecessarily. You see, measuring blood pressure at home is a fantastic tool, but if done wrong, it's like holding a distorted map. The more you follow it, the further off track you go. And at our age, health doesn't give us the luxury to wander too far before finding our way back. So next time you check your blood pressure, remember, it's not just a number on the screen. It's a message your body is sending you. And that message needs to be recorded accurately to protect yourself. The second mistake I see very often, and one that truly worries me, is thinking a little high blood pressure is no big deal. I've heard this countless times from patients. "Doctor, my blood pressure is only 150/90. I'm sure it's fine. At my age, isn't everyone's a little high?" It sounds reasonable, doesn't it? Because we often think a condition is only dangerous when the numbers are very high, 180, 200, and so on. But the truth is, blood pressure is like water flowing through a pipe. If it flows too strongly, even just a little day after day, it will wear down the walls of the pipe. In our bodies, those walls are our blood vessels. And the damage doesn't happen all at once. It builds quietly until one day we face a stroke or heart failure. I'll never forget the story of Mr. James, 72. When I advised him to adjust his lifestyle because his blood pressure was often 145, 150, he just smiled and he said, "I feel great. Still go fishing every week, still climb stairs, just fine." 6 months later, he suffered a mild stroke. Thankfully, he recovered, but his speech slowed a bit and his right hand was weaker than before. He told me, "I wish I had listened to you sooner." I want you to imagine this. If you saw a small crack on your house wall, would you ignore it or fix it right away? You'd fix it early, of course, because if you leave it, the whole wall might collapse. Slightly high blood pressure is the same. It's a hidden crack you can't see, but it's happening inside your body. Science has proven for every 10 mmHg increase in systolic blood pressure, the risk of heart disease and stroke rises significantly, especially in people over 50. That means the distance from a little high to dangerous is very short. What I want to emphasize is this: don't wait until you feel tired, dizzy, or have headaches to start worrying. High blood pressure often has no obvious symptoms, and it's that very silence that makes it dangerous. Have you ever checked your blood pressure, found it higher than normal, but told yourself, I'll just check again tomorrow? If your answer is yes, maybe it's time to change the way you think. Because every day you ignore it is another day your blood vessels face unnecessary pressure. Your health is worth far more than the temporary peace of mind you get from telling yourself, it's probably nothing. Trust me, acting early will always be easier and safer than fixing the damage later. Mistake 3, stopping your medication when you feel well. I still remember one autumn afternoon in my clinic when Mr. Mark, 68 years old, walked in with a big smile. He had been my hypertension patient for nearly 5 years. That day's blood pressure reading was truly beautiful, stable and steady like the steps of someone strolling leisurely in the park. As soon as he sat down, he proudly said, Doctor, I've been feeling great lately, sleeping well, eating well, and my blood pressure at home has been 120/80 for weeks. So I thought maybe I don't need to take the pills anymore. Give my body a break. I paused for a moment. I had heard this story many times before, and it rarely ends well. When we feel better, we often believe we have escaped the illness. But with hypertension and many other chronic diseases, medication isn't just for treating symptoms. It's the holding force that keeps the condition stable over the long term. Stopping it suddenly, especially without your doctor's guidance, is like unbuckling your seatbelt just because the road ahead looks smooth. I gently asked Mr. Mark, do you know why your blood pressure is stable? He smiled, because I'm healthier now. I smiled back and said, because of the medication, the low-salt diet, and regular exercise. Those 3 things are like the 3 legs of a stool. Remove one and the whole seat wobbles. The problem is hypertension and many chronic illnesses are silent enemies. They don't cause sharp pain or instant discomfort, but quietly damage the blood vessels, heart, kidneys, and brain. Many people, after stopping medication for just a few weeks, see their blood pressure spike without realizing it, until a sudden stroke or heart attack strikes. I have seen far too many emergency cases caused by the single sentence, I felt fine, so I stopped my medicine. And every time I think to myself, if only they knew that feeling healthy in that moment was the result of treatment, not proof that the disease had gone away. With Mr. Mark, I didn't scold him. I simply took out a piece of paper and drew 2 blood pressure graphs, a smooth blue line for when medication was taken regularly, and a jagged red line with spikes for when it was stopped. He looked at it for a long while, then turned to his wife and said, remind me to take my pills again tomorrow. We all have the tendency to stop doing the things that keep us healthy once we feel healthy. But health is not a destination. It's a journey that needs to be maintained every single day, even when we're at our very best. Mistake 4, focusing only on medication but forgetting lifestyle. There's something interesting I've noticed after many years of working with patients over 50 when it comes to controlling blood pressure. Many people focus only on the pill. One of my patients, Mrs. Linda, 72 years old, once shared, Doctor, I take my medication very regularly. But why is my blood pressure still sometimes high, sometimes low? I think I might need to switch to a stronger drug. I asked, do you remember what you ate yesterday? She hesitated. Well, I had a bowl of chicken soup, but I added a little salt and some bacon. And you know, this winter, I haven't been walking much. I've been staying indoors most of the time. I smiled gently. This was exactly the point. Medication is only part of the blood pressure equation. The rest, and sometimes the deciding factor, is lifestyle. I often tell my patients medication is like an umbrella in the rain. But if it's raining and the wind is strong, you also need a raincoat, waterproof shoes, and ideally to avoid going out during the storm. Lifestyle is all those extra factors. They help your medicine work at its best. For blood pressure, those raincoat factors include reducing salt eating, more vegetables, limiting processed foods, maintaining a healthy weight, getting at least 30 minutes of physical activity each day, sleeping well, and avoiding prolonged stress. Science has shown that simply lowering salt intake to less than 1,500 milligrams per day can drop systolic blood pressure by 5-6 mmHg, equivalent to the effect of a low-dose blood pressure medication. Or just brisk walking 5 times a week. 30 minutes each session can strengthen your heart and blood vessels, lowering your risk of complications. The problem is, many people think I already have medication, so I don't need to change my lifestyle. But in reality, a good lifestyle can help you reduce your medication dose and even prevent your condition from worsening. After listening to my explanation, Mrs. Linda decided to start with small steps, cutting out salt when cooking, replacing bacon with grilled fish, and exercising indoors by marching in place while watching TV. After just 3 months, her blood pressure became much more stable, and her medication dose was reduced. So if you're taking your medication regularly, but your blood pressure is still not stable, ask yourself, am I really taking care of myself beyond the pill? Because health is a combination of medicine and lifestyle, of the treatment you receive and the daily choices you make. Mistake 5, not measuring blood pressure regularly. I've met many patients who only measure their blood pressure when they remember to. Some go months without checking it. Others only do it when they feel dizzy or have a headache. And when I ask, do you measure your blood pressure at home regularly? They laugh it off. Oh, doctor, my blood pressure is normal. Why measure so much? Besides, I'm busy. But here's the problem. Blood pressure doesn't always give warning signs. Many people have high blood pressure and still feel perfectly fine. That's why it's called the silent killer. If you only check when you have symptoms, you may have already missed the golden window for controlling it. I remember a patient named George, 68 years old. He was generally healthy and only measured his blood pressure occasionally, and each time it seemed okay enough. Until one day he had a mild stroke. At the hospital, his blood pressure was 190/110 mmHg, a dangerous number. The striking thing is just 1 week earlier he felt completely normal. Measuring blood pressure regularly is like checking the oil in your car before a long trip. The engine might run fine today, but if you're low on oil without knowing the consequences could be serious. Research shows that people who monitor their blood pressure regularly at home manage their condition better and have a lower risk of cardiovascular complications. Consistent measurements also help doctors make more accurate assessments, because readings in the clinic can sometimes be influenced by white coat syndrome, feeling nervous around doctors, which temporarily raises blood pressure. I usually advise patients, if you've just adjusted your medication or changed your lifestyle, measure your blood pressure twice a day, once in the morning before taking medication and once in the evening before bed. Once it's stable, you can reduce to 2-3 times a week, but it's still important to maintain the habit. Remember, measuring your blood pressure regularly isn't just about knowing the number, it's about protecting your future. Every time you wrap the cuff around your arm and press that button, you're taking an active step to prevent dangerous events for your heart and brain. My dear friend, I've always believed that the human body is a book that tells its own story. Every wrinkle, every trace of time, and even the faint creak in our joints are all little conversations our body is whispering to us. But the miracle is the story never truly ends. We can keep writing it, shaping a brighter, healthier ending if we start today. You might say, but I'm already 60, 65, even 70 years old. Is it still possible? I've met hundreds of patients who ask me that same question. And each time they patiently made small changes, adding a collagen-rich meal, spending 10 minutes each morning, moving their joints, or simply